really pleased to have received this award to recognise the research that we've been doing. So the research has shown that there's been real progress in reducing Aboriginal and Torres Strait Islander smoking over the past decade, and it's really great to see this sort of good news story being recognised. So we wanted to look at how smoking prevalence is changing among Aboriginal and Torres Strait Islander people in the last decade. So what we found was that smoking prevalence has dropped from about half of adults in 2004 down to around 40% of adults in 2015. And so that's a great story, and it means that there's about 35,000 fewer Aboriginal and Torres Strait Islander adults who were smoking in 2015 compared to if things had stayed the same. And this means that there will be thousands of premature deaths avoided because of that. In this work we didn't look specifically at what was causing the decline, but we do know that there's local and national Aboriginal and Torres Strait Islander tobacco control that's been implemented since around 2008. So while we couldn't measure that in this study, we do think that that's had a very big impact. So most research in Indigenous health focuses on gaps and disparities between the Indigenous and the non-Indigenous population. And instead we wanted to look at how things are going within the Aboriginal and Torres Strait Islander population. So when you focus on gaps, it often looks like things aren't changing. But when you look at how things are going within the population, we can see that there's been a substantial decrease in smoking prevalence. So again, when we just focus on the gaps, you lose sight of all the progress that is happening on the ground. So we did see that progress was happening much quicker for people living in urban areas and for younger people. So we do want to focus on what's working in those settings and why things aren't working so well in remote areas and for older people. And so we do think that the Aboriginal and Torres Strait Islander smoking programs and policies are having an impact here, but we don't have the evidence to prove it yet. So we would like to get robust evidence on the impact on those programs and to try to scale up what's working across the country. Yeah, we'd like to thank all the Aboriginal and Torres Strait Islander people who shared their data and their story with us to make the research possible. And we'd also like to thank all those at the ANU who have supported the research. And we'd like to acknowledge all the hard work of the communities and service providers on the ground who are making a difference in reducing smoking.